True peace, Kens. It is August 18th, 2020, and I am back at y'all with another one. And if you trying to stay ahead of the game, you should subscribe to Peep the Slang. Cell phone data shows how Las Vegas is gambling with lives across the country. Say, man, that's the headline. Peep the Slang. When it comes to COVID-19, what happens in Vegas doesn't stay in Vegas. Las Vegas casinos reopened June 4th, and they have become a likely hotbed for the spread of the novel coronavirus, public health experts say. But if tourists return home and then test positive for COVID-19, the limitations of contact tracing in the midst of a pandemic make it unlikely such an outbreak will be identified. Contact tracing, one of the pillars of stopping the pandemic, is a labor-intensive process where a health official tracks down anyone who's been in contact with an infected person and takes steps to prevent the disease spread. But there is no national system in place for contact tracing, said Joshua McCall, an epidemiologist and associate director of global health policy for the Kaiser Family Foundation. It's decentralized and performed by local health agencies that may not communicate with one another, especially given their caseloads. So if a casino had a cluster outbreak or super spreading event among visitors, it's unlikely contact tracing would catch it, McCall said. The way it's set up right now, contact tracers are not looking for clusters that might identify outbreaks tied to traveling to a casino or other specific locations, McCall said. You're not actively looking for it, so you might miss that event. Contact tracing is not set up to answer those questions, so you'll still be in the dark. A new analysis of smartphone data conducted at probable request shows how interconnected the country is with visitors to Las Vegas, which heightens concerns about the limitations of interstate contact tracing. The companies Xmode and Tectonics analyzed travel to and from Las Vegas during 4 days, a Friday to Monday, in mid-July. In compliance with privacy laws, Xmode collects data from smartphone users, mainly those using fitness and weather apps that track their location. The data represents about 5% of the smartphone users in the United States. Tectonics analyzed the data and visualized it on a map. During the 4 day period, about 26,000 devices were identified on the Las Vegas Strip. Some of those same smartphones also showed up in every state of the mainland except Maine in those same 4 days. About 3,700 of the devices were spotted in Southern California in the same 4 days, about 2,700 in Arizona, with 740 in Phoenix, around 1,000 in Texas, more than 800 in Milwaukee, Detroit, Chicago, and Cleveland, and more than 100 in the New York area. The cell phone analysis highlights a reason the virus keeps spreading, said Oscar Aline, an epidemiologist and chief program officer with the National Association of County and City Health Officials. People have been highly mobile, and as a result, it makes sense why we see the continuation of the surge. Typically, public health agencies talk to one another at the state level, said Kimberly Hurt, disease surveillance supervisor in the Office of Epidemiology and Disease Surveillance for the Southern Nevada Health District, which includes Las Vegas in its territory. During the pandemic, local agencies have reached out directly to one another, she said, but the data isn't tracked in a way that can show how often that happens with visitors to Las Vegas resorts. COVID-19 has made it impossible to get a complete picture in real time, she said. In the 5 weeks after Las Vegas reopened, the number of daily COVID-19 cases rose tenfold. Clark County has now had more than 50,000 cases. The number of new cases per day has declined since then, but the tally in Clark County, where Las Vegas is located, remains high enough that the Harvard Global Health Institute recommends stay-at-home orders. There are no such orders in place. Hurton said the virus presents an overwhelming contact tracing challenge. Its incubation period is up to 2 weeks, so by the time it's discovered in a tourist who came to Las Vegas, the person would probably be home. It's pretty much impossible to identify the source of the cases, Hurton said. Contact tracing efforts are focused on the person with a confirmed case to make sure they don't spread it to others, not identifying the source of that person's infection. Hurden said, once you've reached the point of community spread with this virus, it's hard to jump to that conclusion of any cluster or outbreak, she said. Beyond that, with the numbers as high as they are, local health departments can barely keep up with the cases of people who live in their jurisdiction. Our systems are in place for doing this when diseases are not highly prevalent, like an E. coli or salmonella outbreak traced to lettuce or onions. Aline said, but the COVID-19 is affecting hundreds of thousands of people, he said. That magnifies and overwhelms the system. Public health experts say there are several keys to containing COVID-19: social distancing and wearing masks around others, having abundant and timely testing to see who has the virus, contact tracing to encourage those who had contact with infected people to isolate, and isolation for those infected. Reducing unnecessary travel and outings also help stifle the virus. In some cases, casinos say they are doing their part to identify situations in which their guests may have been infected during their stays. MGM Resort International, which owns the Bellagio, Aria, Mandalay Bay, and other properties, say in its safety plan that guests should email the company if they test positive. MGM provided with a statement about its safety efforts, but the company would not share how many times it had received emails. MGM also declined to say how many times it had notified the Southern Nevada Health District about possible transmission of COVID-19 on one of its properties. MGM's policy of having guests email the company and then referring them to the health district is a lot of steps in a chain where you could miss a connection, McKay said. If someone gets tested when they get back home and don't email them back, it's a piece of information they would never get. Hurden said the Southern Nevada Health District has received reports from the casinos about cases, but the available data doesn't allow for any easy way to show which resorts or how many cases, she said. That may be possible to say in retrospect after the virus have subsided, she said. The number of visitors to Las Vegas has steadily increased since it reopened. Many drive from neighboring states, and more than 1 million passengers came through the airport in June, which is about a quarter as many as the same month in 2019. Air travel nationwide is down more, 80% in June compared with the previous year. The cell phone data analysis shows how travel to Las Vegas could be fueling the pandemic, Aline said. In this rush to reopen and reposition the economic activities, all we've been doing is spreading and amplifying the reach of this disease. Gambling with lives. Spoke to 6 public health experts who call casinos a high-risk environment for COVID-19. They are indoors, potentially crowded, and filled with people prone to taking risks. It's almost certain, the experts said, that casinos are feeding ground for COVID-19. There is a serious opportunity for spreading the virus, especially for people who are midly sick or don't know they're sick, said Crystal Watson, senior scholar at the Johns Hopkins Center for Health Security. Up to 40% of those infected with COVID-19 show no symptoms. We've seen big outbreaks kick off by these types of situations. Working in Las Vegas, worry about the spread of the virus too, Ralph McIver calls the Kitchen of Binion's Cafe, where he works, a melting pot of employees. The cafe is located in Binion's Gambling Hall on Fremont Street in downtown Las Vegas. During his shift, McIver works almost elbow to elbow with 2 colleagues on the cook lines, grilling up ham and eggs, hangover burgers, and cowboy cheese steak sandwiches. It's difficult to stay socially distanced, he said. McIver is diabetic, which puts him at higher risk of a severe case of COVID-19. He also lives near his elderly mother, who is also at high risk. Binion's didn't require employees to be tested for COVID-19 before returning to work, which made McIver uneasy. He would feel better if he and his colleagues had initial and follow-up tests, he said. The longer the pandemic goes on, the more worry he feels. My concern has only gotten worse. Binion officials did not return requests for comments. Nevada Regulators set minimum standards for COVID-19 protections, but allowed the casino to choose many of their own safety measures, to the dismay of many workers. That's not a surprise because gaming companies have significant sway over policies made in Nevada. Las Vegas could almost be called a company town, and its economy depends on tourism, even if the pandemic. In a rambling and continuous interview with CNN's Anderson Cooper during the shutdown, Las Vegas Mayor Carolyn Goodman advocated for reopening despite the virus and appeared to offer the city as a sort of control group in an experiment. How do you know until we have a control group? She asked. We offer to be a control group. When it comes to regulations in Nevada, Michael Green, a historian at the University of Nevada, Las Vegas, put it this way: the casino industry is the tail that wags the dog. It may also just be the dog. The casinos do operate in a much different way since the start of COVID-19. Capacity is limited. Workers are checked for symptoms every day. Slot machines and seats at gaming tables are spread apart. Plexiglass barriers separate dealers and players, and hand washing and sanitizing stations are located throughout the properties. But in other ways, the regulators allow the casinos to take the same very response to the coronavirus as has taken place from state to state. At first, guests were not required to wear a mask, even when indoors, which is one of the main protections recommended by public health experts. After COVID-19 cases started rising, Governor Steve Sisolak, a Democrat, ordered face coverings for everyone in public spaces, particularly indoors. He also ordered the closure of bars in certain counties, including Clark. The company's reopening plans varied in significant ways. Wynn Resorts required every employee to be tested, for instance, but MGM did not, and the standards that have been set have been evenly enforced, workers told the people. They said that even now visitors can go without masks by saying they're smoking or drinking. The biggest push for improved safety has come from the workforce. Officials from Culinary Union, the largest union representing the hospitality employees in Las Vegas, said in the initial weeks after reopening, the documented scores of cases where guests did not wear a mask or failed to stay distant, or casinos ran out of hand sanitizer or protective equipment for workers. The union filed a lawsuit in late June against several properties, accusing them of failing to protect workers. It's now been resolved, with the union and companies working together to pass legislation that was signed by the governor that establishes protections for the workers, including standards for cleaning, social distancing, and hand washing. Notification within 24 hours if they may have been exposed to the virus, and inspections to ensure compliance. Workers have also questioned the casino's effort at contact tracing. Jessica Bremer's experience became part of Culinary's union now resolved lawsuit. In mid-June, Bremer said she heard from colleagues, not her employer, that one of her co-workers at Guy Ferry's kitchen, Vegas kitchen at bar tested positive for COVID-19. Bremer, a specialty cook, said her employer, the Link, which is owned by Harris, part of casino giant Caesars Entertainment, did not handle the situation in a way that she believed protected her and other workers. Bremer showed up for her shift after hearing her colleague had tested positive, but she told her supervisor she didn't feel comfortable working. Bremer, 35, suffers from multiple sclerosis and, let me get this word for you, autoimmune disease that makes her more susceptible to a severe case of COVID-19. According to the lawsuit, one supervisor told her she would have to deal with it, and another told her she could continue working. Oh, okay. The company's security team was determining which employees could be at risk because of contact with the infected worker, she was told. That didn't sit well with Bremer. Security officers didn't have a medical degree, Bremer said if someone is going to deem what's safe and what's not safe, it should be a medical professional or someone with COVID training. Even after finding out Bremer had been on a recent shift with the infected employee, the company told her and other colleagues to work that day. She said the employees pushed back and so many refused to come to work the next day, they closed the restaurant for 10 days, she said. Employees were paid during the closure, she said. Employees at other casinos made similar allegations in the lawsuit. Officials from Caesars about Bremer's account of the restaurant closing, they declined to talk about what she said, but they provided a statement saying their properties have deployed an extensive contact tracing program that leverages all sophisticated surveillance, security, and human resources tools. The properties have also put extensive safety precautions in place, the statement said, and employees who are at high risk or do not want to come back to work are allowed to defer the return. A spokesperson from Nevada Department of Health and Human Services said 337 non-residents tested positive for COVID-19 in the state in June and most of July. The state agency could identify 10 out-of-state residents who were believed to be infectious while visiting Nevada and who tested positive for COVID-19 when they returned home. Public health experts said those numbers fall short of quantifying the problem. The state numbers are certainly a significant undercount, said Aline, the epidemiologist with the Association of County and City Health Officials. Reopening Las Vegas is gambling with lives, said Michelle Fullett-Turk, an occupational health historian at UNLV. The government gambled by letting the casino owners create their own health and safety plans and failing to require masks until after the COVID-19 numbers were rising, she said. The employers are gambling with employee lives because they want to make a profit, Turk added. But employees are gambling with their lives. They need a paycheck. A forest fire. Pinar K., a Georgia Institute of Technology professor who specializes in infectious diseases modeling, compared the COVID-19 cases coming out of Las Vegas to a forest fire. Imagine if a group of trees was on fire and then some of the flames jumped to another area where they ignited other trees, she said. That's the kind of spread that can occur nationwide because of people gathering in Las Vegas, she said. The risk is much more significant than the risk posed by schools reopening, Pinar K. said. At schools, the same group of students and teachers interact with one another every day, and they're likely to live in the same geographic area. So any infection transmission will be contained within the group and perhaps their families. But in a casino, people from all over the country gather, and they get together in new groups every day. They return to places all over the country. In this way, she said, Las Vegas could significantly fuel the disease spread. Discrepancies in how policymakers protect the public magnify the problem. PNRK said our county or state might have strict interventions like sheltering in place or mask wearing, but a neighboring area might not. She said it's important to have a concerted effort nationwide. PNRK said if you are doing these interventions in a haphazard way and not coordinating, then we make progress and we regress again. McCall said Kaiser Family Foundation epidemiologists said there are countries that were able to suppress the virus early on, and now they are returning to almost normal. But that's not what happened in the United States. So now policymakers are trying to strike a balance between preventing the spread of the virus and resuming normal activity. And in many locations like Las Vegas, decision makers have sided with opening the economy. I don't expect a major lockdown occurring anytime in the near future, he said. That means there's likely to be continued transmission. It's horrifying, but it's true. Loyal visitors to Vegas say they will keep coming. Michelle Hale and her husband take 3 trips a year to Las Vegas, where they are regulars at El Cortez and Casino on Fremont Street. The couple lives in a central Illinois, where Hale says she is a social worker who does healthcare administration. Their June trip was planned before the pandemic hit, and they had no concerns about going. Things went smoothly, she said. She was more worried about COVID-19 on the plane than in the casinos. Their temperatures were taken when they entered each property. People stayed socially distant, and the cleaning crews were active. Before we left, we already had our next trip planned. Hale said we were going back in September.